My name is Jaime Aguda Falgu. I'm a 38-year-old mother of two, registered nurse, and my mother died when I was 12 years old from breast cancer. Her mother also had breast cancer and lived to be 89 years old. So in 2005, I tested positive for the BRCA1 gene, that is the gene that causes breast cancer. And I was trying to get pregnant for my second child at the time, so I put the results off for a while. So in 2013, I remember hearing about Angelina Jolie, who was also BRCA positive and decided to undergo a bilateral mastectomy with reconstruction. And so I pulled out my test results, sent them to my OBGYN, had him interpret the test results, and thought I was crazy for sitting on those test results for 5 years. So I decided, actually it was 7 years, I decided to do some research on different physicians, on surgeons for the mastectomy with reconstruction. And they were referred to me by fellow nurse friends and said Omega Hospital is a phenomenal facility to have this surgery, and their surgeons were the best of the best. So when I went to see Dr. Sadeki, he encouraged me to have the nipple and skin sparing bilateral mastectomy with reconstruction with the DIEP and PAP procedures. And so in December of 2013, I underwent the procedure, and then in March of 2014, I did my stage 2 procedure. And then in December of 2014, I did a skull revision procedure. So 3 surgeries in 1 year. And I am proud to say that I am 100% done and complete and very happy with the results. Since my surgery, I have met plenty of women who suffered breast cancer and have gone through the same procedures that I've gone through. I could never imagine having to go through breast cancer in addition to the surgeries that I have. These women have been an unbelievable inspiration to me and my friends and my family, and they have encouraged me to move forward and to promote those people who have a family history of breast cancer to get tested for the BRCA1 gene or the BRCA2 gene, and if you are positive, to have the bilateral mastectomy with reconstruction, because it is worth it. It drastically decreases your chances of breast cancer from 87% to 5%. And I did that strictly for my children. I have 2 children, and by losing my mother when I was 12, that is the one thing that I did not want my children to go through. So these women who I've met throughout the last year and a half have inspired me so much to be a breast cancer advocate. And if you are positive for breast cancer or have the gene, to have the surgery, it will prolong your life, and you will be here to live longer for yourself and your children and your family and friends. Having met Dr. Sadeki is probably one of the most important things that I've ever undergo in my life. He totally changed my life. He has been very supportive. Being a registered nurse for 14 years now, I've met plenty of doctors along my way who were arrogant and just downright mean and horrible bedside manner. Dr. Sadeki impressed me so much with my first visit that I knew right then and there that I wanted him to be my surgeon to transform my body completely. And seeing his work is amazing. He is an amazing physician. Not only he's an artist with his hands, but he has the best bedside manner ever. He becomes more of a friend than a physician, and his patient-doctor relationships, they carry on for years, if not longer. He is very caring and nurturing, and his staff is as well.